Listening to your talk, Stephen, because of the music theme. And when I walked in, I saw this window, and I really did feel like Snoop Dogg, because apparently, it really felt like a music theater here. There are a couple questions probably that we're all here to ask and answer, hopefully. Why are we trying to measure social value? What exactly are we trying to measure? And then how can we go about doing that? So with GSK, the why comes into our kind of strategic priorities. So why exactly are we looking at this? One, it's a business imperative. I think it was mentioned earlier that these themes of social impact and what the environment looks like really do feed into the long-term business goals. But it's more than that. It's about building trust in the community. It's about having a license to operate. It's about opening innovation and making sure that we're building capacity on the ground, making sure that we're building infrastructure. It's a lot that goes into social value, and we have to be very clear about what we're trying to measure. And at GSK, what we try to do is really define where our value is in the system. And when we look at what we're able to deliver, essentially it's about innovation. It's about delivering that product that can potentially eradicate a disease or save someone's life, or just simply help them live a longer, healthier, happier life. And that's really where we sit in this value game. It's really about delivering that innovation and then expanding access to that. So I belong to a group called Developing Countries Business Unit. And essentially, our goal is to expand access to the 800 million people that live on $1 or less in the 50 least developed countries. That's really what we do. And we kind of built that we built kind of our value into our entire business model. So there are a couple ways that we kind of measure social value, one of which is built into the operating model. So this is all the way down to the incentives that we give our salespeople on the ground in these 50 developing countries. So it's essentially a lower price, high volume operating model with a volume incentive. So really what we're saying is it's not about profit. We actually drop the price of a lot of these medicines that we distribute in developing countries. We reinvest 20% of any profit that we do make back into the healthcare infrastructure in the country. And the target really is a 5-fold increase in volume in these target countries until 2015. So when you think about that, it should actually change the behavior of our people on the ground, because you're actually going to lower cost items, ones that have a mass appeal. And those low-cost items are essentially those essential medicines that people need on an everyday basis. So it's around malaria, it's around HIV, it's around some of these diseases that have a huge impact, low-cost products that what we're trying to do is expand access to them. And then the other way that we measure kind of our impact on social value is through our CR commitments. So we have 23 corporate responsibility commitments that we nicely framed in 4 kind of categories on health, our behavior, our people, and our planet. So that environmental piece comes in, the access piece on health for all, our behavior, talking about open innovation. So we share not only our clinical trial data, but we open our labs to up-and-coming scientists so they can come and join and learn from our scientists in Tres Cantos, which is a facility in Madrid. And our people. So I've heard a couple times mention about employee satisfaction and retention. We really do take that seriously, and we at GSK, after looking at kind of our measure of access to medicine over the last 3 years, we really feel like we have something going here that makes people proud to work at GSK. Now, the next steps in measuring social value, so there's a kind of the global theme on how do we measure kind of a cumulative input, and then there's something about our individual social programs, because these are essentially 2 very different things. It's a lot easier at a social program level, potentially, to measure the direct outcome or impact than it is at a global level, looking at a lot of different variables that you can't actually kind of keep control of. So what we're trying to do is partner. So partnership is key to a lot of the things that we do in this space. And our partnership with Save the Children is a global partnership where we're looking to enhance our measurement and evaluation capabilities. And also our target is saving 1 million children's lives. So we put a target on that so we can start to put some measurement and evaluation around how we actually get there. And the partnership is key to allowing that. Developing a framework that ensures our programs are designed to be sustainable, are designed to be scalable. These are things that I think sometimes come in at the back end of a program that you've already kind of developed and rolled out, as opposed to thinking about some of these things from the beginning. And we are getting a lot better. We weren't the best at this, but I think we're getting a lot better about thinking about these criteria of sustainability, scalability, whether or not it's strategically aligned with our business goals, external goals like MDG, Millennium Development Goals. And really looking at the social value. So what is the health cost avoided because of the initiative that we put in play? So we're really looking to kind of just provide some consistency across the globe. We have operations in almost every country in the world, and each one of those operations wants to give back. They want to do something good, and providing some framework for consistency is a good first step to allowing that kind of funnel of success through all of our initiatives. The last thing is around supporting an open source database. So data actually is a real issue in developing countries. We don't have data on who gets what medicine, how much medicine is being sold. We don't really have a good sense of data, but that data constraint extends beyond just product data. It actually goes into what healthcare models actually exist. What are some of those innovative models that are out there that just don't have the appropriate scale or investment? And really what we're trying to do is support an open source database that allows everyone to kind of tap into what's out there, what's actually working, so that we can then pool investment, crowdsource, blended capital, however you kind of view the approach, but it's around getting a higher level of investment in things that are working. When I first entered the space, I guess almost a year ago, the first thing I saw is that we do a lot of pilots. There's a lot of individual pilots that have been funded across the world. And what we really, as a group, don't do well is kind of scale up those things that are working. Identifying them is a good first step, and that's what this is intended to do. I think we're all aware of the challenges. So attribution is a very difficult one because of that causal relationship between what you're doing and then what actually happened. There's always someone there probably to challenge you to say, hey, there's all these other variables, and how do you know whether or not your intervention, your program is the actual cause of that outcome? So it's a very difficult question to answer because of the lag times between impact and outcomes and when these things happen. So we're really trying to take a look at this, and associated with that is actually the cost of keeping that measurement over time. You know, if it takes a very long time to actually get that answer, you also have to pay along the way in order to try. And there's not much investment in measurement. And the last thing here is the potential unintended impact, so that's around the environment, and we can discuss that further as well. So my time is up, and I think I'm over here now, yeah?
Yeah.